these are not simple, easy questions to answer.
There was a lot of indications that we weren't really ready.
Canada has had a medical assistance in dying law since June of 2016, but having a sole mental disorder has excluded you from eligibility. In March, that's set to change, but a group of psychiatrists across Canada are trying to delay that.
We are admitting in our specialty that the issue of predictability of you won't get better, we don't have a reliable template. We don't have a tried and true consistent definition.
To qualify for MAiD since 2021, there have been numerous thresholds to meet, including having a serious and incurable illness, disease, or disability. You must be in an advanced state of irreversible decline in capability and have enduring and intolerable physical or psychological suffering that cannot be alleviated under conditions the person considers acceptable. The problem, these psychiatrists say, is that mental disorders are complex.
Whether it's somebody with depression or another person with schizophrenia or somebody with addictions, there's no current definition that says that this person is irremediable and will never get better. So that fundamental eligibility criteria around MAiD has not been sorted out in the world because there's only a few countries in the world that actually allow this to happen.
Dr. Jack Haggerty says all procedures and policy are still at the advisory phase with the federal government, and there is too little time to roll these out to medical professionals in 3 months.
If you can imagine a surgical procedure that is to be implemented across Canada, a few weeks notice to implement a procedure, as important as this, you'd want to have it done with some, careful scrutiny and evaluation.
These doctors say there is no information on how many Canadians with mental illness will seek MAiD, no information on how many psychiatrists will agree to assess patients for MAiD, or how many assessments would be necessary to decide their disorder is irremediable. They also say more work needs to be done to see if this new eligibility will more greatly affect certain demographics.
I think are critical to avoid an unfair distribution or implementation of this in cultural groups or our at-risk population.
Dr. Derek Smith, a psychiatrist with the University of British Columbia, says these calls to delay changes to the MAiD eligibility are premature until the federal government's framework is released. There has been a thorough and fulsome process to examine this issue. No action needs to be taken to derail or delay the implementation of legislation until the Special Joint Committee issues their final report. In Winnipeg, Mike Albanese, City News.